started. All right, so welcome. This is Psych 105. We are now recording. I'm going to answer a couple of the questions here before we get into our lesson today. So one question that came up, I know it's the start of class, but I have a question about the syllabus. Okay, on syllabus it says need to read chapters 4 and 5, but during week 3 we were going through chapter 3. Are we reading ahead to stay on top of schedule? So yeah, the question is, why are we reading chapter 4 and 5 for, was that week 4, according to the syllabus, right?
I think week 3, I don't know, on the syllabus it says reading 4 and 5, so I just want to make sure, like, are we reading ahead just to stay on top of schedule, or do we be because I'm already done with chapter 3, so.
Okay. Let me bring up the syllabus here. It's quick.
No.
All right, so the syllabus, according to the syllabus, we are doing chapter 4 and 5. Okay, so that's just for this week. Okay, for I'm sorry, for week 3. Okay. Yeah, so the reason we are doing that is because my goal is to get through adolescence. It's very hard to do, and believe it or not, I know we have 16 weeks to do that. It's very hard to do that when we have 15 chapters. So I want to give, I did this with the intent of giving you a nice long break for midterms, because I want you to do well at midterms, and I want to give us a nice long break on week 15 to get through our projects. So I did rush it a little bit. If we do need to slow down and take some time on one particular area over another, we can certainly do that. Okay, but yeah, that's the reason I kind of, and it doesn't happen throughout. I mean, once we get into week 4, we're just doing one chapter. We're doing chapter 6. Once we get to week 5, we're just doing chapter 7. Yeah, I think the first 2 weeks are the only 2 weeks that I believe I rushed that I'm seeing on here. Okay, so does that answer your question?
Yeah, that answers my question.
Okay, all right. Let's see, Jets, it's going to be a long season. Yes, it is. So, still have so Jada, get with me after class on this, on your question. We do not have groups yet. I'll be working on that this week. Okay. All right, so we are not skipping chapter 3 completely. In fact, you took your quiz involved stuff on chapter 3. In fact, today's lesson, I do want to go over some concepts in chapter 3, just so we get started off right. And then Thursday, I'll talk about growth and health. Okay. So, any other questions before we get moving?
I have a quick question.
Go ahead.
Like, when we're trying to find articles or anything, like another source, is there any like things that that we can go to? Because the database, a lot of those are have a lock symbol on them now.
Yeah, and I believe, let me go through that one more time. I thought I did it with this class. I'm not sure if I did or not. So I'm gonna walk through with you on how to do that. So share my screen. All right. So again, if the best way to go through it is KEMP Library, because I know exactly where it is from here. And it used to be, if you went through D2L, you could get to the databases with really little problems. But now I guess it's locked everything down and you still have to log in. So you go into, on the right-hand side, you go into databases. And I use, my favorite one is, you can either use developmental psychology or psych. There's a lot of developmental psychology in PSYarticles. That's my favorite one to use. When you get in here, just simply pick our university. And I think if you expand this out, it might look a little bit differently. So mine was clumped together. But if you expand this out, you're going to use the one on the right. Okay. And then just enter your credentials in here. And then cross your fingers that it works. Waiting. Bueller. There we go. All right. So then it takes you right to EBSCOhost. And when you get in here, of course, you can just like child development, urban areas as an example. Okay. And that just like a Google search, it'll bring up depending on how much information. Now for this one, I've got 978 hits on this. So I can go through them. Usually the most relevant and timely ones, the most up-to-date ones are going to come up first. And then they kind of go to the less relevant and more further back in time. So, and again, you can view this either as a full PDF. I like reading them with the website because it just looks a little bit neater. All right. So does that answer your question, how to get there?
Yeah, no, I had known how to get there. It was just when I went to like try and get into it, it wasn't loading and letting me like get access to it. As you were doing this, I did it again, and now it's letting me get access to psych articles.
Okay.
Like, logging in, it wasn't going through. It was like stopping, and I thought it was weird.
Yeah.
So I was wondering if there was like any other sources if we couldn't use the database. Like, could we like use something else? Is there any other sources?
You can use Google Scholar as well. So if you type in, like, if you have, Google, that's another one that I use, Google Scholar. And that usually, and wait, where is it? Scholar button, extension. But they're like scholarly articles, and they usually come up accidentally for me in Google. Oh no, yeah, the Google Scholar came up. So if I look up child development, it'll give me a similar hit, but it might go across several databases. Some of them might be locked, but some of them might be free. So anyway, I know what you're saying. I mean, EBSCO is just very touchy. Sometimes it works great. A couple times I've had it just completely crash on me, and usually at the most inopportune times, like when we have an article review or something important due. But yeah, it's finicky, but you can at least get to it that way. And then of course, Google Scholar is another means by which you can get in there and do stuff. Okay. All right. All right, so let me share my screen with you here. So the area I wanted to cover today, I know we didn't have a lot of opportunities to really go over what happens in the neonatal stages, but it's really important to understand this as we maneuver, as we go through this class together, okay? So we've probably all have heard of trimesters, right? Now, what are trimesters in pregnancy?
They're the stage of like the baby growth. The first 3 months of the first, the second, like the 3 to the 6 to the second, and the 3 to the 9th third trimester, and like, each one the baby developing differently.
Right. Yeah, exactly. 100% correct. So the pregnancy is broken into almost 3 equal parts, right? So the first trimester is weeks 1 through 12, and we consider that the most fragile period because that's where all the organs and systems and the baby's body starts taking form. So very crucial period for considering like the stress of the mother, and of course the stress of the mother and the baby goes throughout, but this is one of those critical periods. You know, what kind of influence, either environmental or chemical, influences can this have during this important part when the baby's organs are developing, right? Especially the heart and the brain and liver and kidneys. Yeah, this is where they start forming. Most birth defects occur during the first trimester, okay, believe it or not. Now, each trimester has something a little bit different, but anything that happens significantly to the mother's body can really carry over into the baby's long-term health, right? So during the second trimester, which we consider to be weeks 12 through 24 or 13 through 24, the fetus is now, they have their organs developed and they can just start focusing on gaining weight and gaining size. For the most part, they're almost independent and almost stable, depending on how far into the trimester, and we'll talk about that. But I should be writing this stuff. So first trimester is 1 to 12 weeks, and organ development is probably the most important takeaway on that. The second trimester is, we're going to say 13 to 24 weeks about. And it really depends because a lot of doctors, we have two, we really have two periods that some doctors, depending on where they fall on this, might consider a crucial period where they might want to deliver a baby. Some of them it's at 40 weeks. They'll put a timeline for 40 weeks. Some of them might be 42 weeks. So it really depends on the doctor that you talk to. But for the most part, I think we consider 39, 40 weeks as a good, healthy weight. So 13 to 24 weeks. And the focus is going to be on size and weight growth. Okay. Now the third trimester, the final trimester, we're going to call that from weeks 25 to 39, 40, or 42, depending on which doctor you talk to, right? So the third trimester marks really the home stretch, and this is where the mother and the baby prepare for the birthing process, okay? We consider the third trimester pretty much an independent period where the child, anytime in that 25 to 39 weeks, could come out and still function as a normally functioning adult, or I'm sorry, person or baby. Now we could have developmental issues that occur depending on how closer you are to this 25 line. But for the most part, you know, we want to really, our goal is to make it to the 39, 40. And this is where we talk about health of the mother, rest, stress, all those things, where those come into play to make sure that we get more of a better developed child. Okay. So your book, I don't think your book really talked too much about trimesters, but I wanted to bring that up because that's what we're most familiar with. Your book, however, breaks it into weeks. Your book talks about like period, the zygote or germinal period. It's the 1 to 2 weeks, so within that first trimester, where we just experience the fertilization of the zygote or the egg. It implants itself into the uterus. It grows rapidly, almost every 12 hours. It's probably one of the fastest growing organisms that we have, or not organism, growth that we have in our body, and in such a short time. So again, we call this a germinal period because the germ disc, it attaches to the uterus wall and starts growing by leaps and bounds. The placenta starts to develop, right? What does the placenta do? What is the placenta?
I'm not really too positive about this, but isn't the placenta what covers the baby?
Close.
Can I say? Can I say what it is?
Yeah, go ahead.
Um, in the textbook, it said it has like nutrients
Mhm.
and waste between the mother and the developing, and it develops the baby, like it has nutrients and
Right.
let me just read it. It say a structure for exchange nutrients and waste between the mother and a developing organism.
Exactly. So forgive my drawing here. So this is a newly fetus, okay? You have the mother's uterine wall here. So the placenta is kind of like a pillow that attaches to the fetus. And it's kind of it's a buffer where it basically sustains its own life. It has processes in here to produce clean oxygen, to produce amniotic fluid, to get nutrients to and from the mother and the baby. So kind of an exchange here. So we look at it as kind of a life-sustaining pillow, just filled with nutrients and life-sustaining functions, okay? So this is important. This is important to understand. Again, a mother's, at this point, she's sharing all these nutrients with the baby, and anything she puts in her body will be transferred. And why is that important for developing cells? Because of toxins, right? Viruses, things that could transfer to the baby that might not be wanted or promote growth. So we got to be very cautious. But that usually occurs, the growth of the placenta and the fetus go into a period that we call embryonic period, or I think your book calls it the period of the embryo. Embryonic. Which is about 3 to 8 weeks. Okay, so during this stage, the amniotic sac forms. Now, the amniotic sac is it's like an extension of the uterine wall, and it helps the baby to protect it from the elements, protect it from heat. It also contains all the fluids that help with skin growth. So it helps to reinforce the umbilical cord. So there's a lot of reasons why that embryonic sac is important for the birth and for the growth of the child. Okay, so embryonic period is more protection and continuing nutrition and feeding. Nutrition, there we go. All right, and the last stage that we're going to look at is the fetal or period of the fetus, fetal stage. Period. Okay, so this is another vital period. You remember what we talked about within the first trimester is what? Important for organ development, right? So within that 1 to 12 weeks. So the fetal stage really starts at week 9. So it's within that first trimester. See how that kind of works? And that goes up to week 39 to 42. Okay, ideally 39 is what we want to see. But during the fetal stage, we're going to see brain growth. We're going to see all regions of the brain develop. We're going to see the cerebral cortex, because if you remember, we have the hindbrain and the lower brain. and as we move out, we start developing our cerebral cortex, our occipital lobe, our temporal lobe, our parietal lobe, and our frontal lobes, right? Those all start developing right around I think it's right around week 10 to 12. So they start taking form, and those are important for learning, for memorization, right? During this period also, the embryo starts developing sex organs. So testes and ovaries, we'll start seeing that occur. The skin starts thickening a little bit. We'll see eyebrows start to form and eyelashes, okay? Heart rate variability. Now, if anybody has, if you either had your own children or if you've observed having children, you probably know that the heart rate is like all over the place, and usually it's really, really high. That's because it's getting blood flow throughout the body. It's very tiny, so it can beat fast. There's not a lot of muscles to really move fast. But as that fetus starts to get a little bit older, he or she will start to reduce in that heart rate. It'll become more normalized, okay? Age of viability, of course, right, we talked about, it is possible to have a childbirth at 25 weeks and still be life sustaining. Usually at that point, they're going to need some kind of assistance and incubators and breathing help, but the longer they're in, the more viable they are and self-sustaining when they get out, okay? We'll start seeing behaviors in this stage towards the later part. Actually, I think I have this is from your book. I did put this in here for you. So as you can see, right around week 16 to 20, the end of week 16, we'll start seeing the heart and the limbs start operating independently, right? I'm sorry, no. Well, they're formed here. I'm trying to see what green means here. Eyes, ears. Because these are always forming. This must be, I think the difference between the blue and the green must mean they're developed and forming, I'm guessing, it looks like. Yeah, so they're probably formed right about here, like your eyes, and then further develop throughout the rest of the semester or trimester. Okay, so this is again, I believe this one's in your book. If not, it might be in your slides, or you can just review this video if you want it. But anyway, this kind of shows you the physical development as we go along. So until we get to about week 38, where we have a fully grown fetus, right? Infant, ready to be born. All right. All right. Any questions on those trimesters and growth periods? Now, it's important to remember, again, keep those two separate. Trimester is more of a timeline of what's developing and when, whereas those growth periods are specifically when is the embryonic period, when is the fetal stage, when do organs start developing, that sort of thing. Okay, does that make sense? I just didn't want to get anybody confused as far as, where does the trimester, which one of those does a trimester fall under? Because I think I've had a lot of questions in the past about people getting confused with what trimester is versus those growth periods. All right. So with neonatal, we talked about earlier, some risk factors. What are some risk factors to a mother who is pregnant and getting ready to enter motherhood?
The stress she's experiencing can affect the baby.
What she's experiencing? What?
If she's experiencing stress, it can affect not only her health but the baby too. Stress,
okay. Stress is a big one, right? Because what does anxiety do to an average person?
Makes you I don't know. It's kind of hard. I was gonna say different for everyone.
Anybody?
It raises the heart rate.
Okay, so when we experience stress, we have an increase of heart rate. Okay, not necessarily bad for an unborn child yet, but you know, it could be a risk factor. What else?
Like preeclampsia.
Okay, that would be a result. Okay, preeclampsia, which is a swelling of tissue, right?
Could drinking and smoking be one?
We're going to get to that. That's a risk factor, absolutely. But what we're talking about stress. How can stress affect an unborn child or mother? Or think about yourself. What does stress do to you if you experience high levels of stress over long
Doesn't it
periods?
like raise our blood pressure?
Blood pressure, okay. Blood pressure goes up, okay. That could be a problem.
Releases cortisol, the stress hormone throughout your system.
Good, good. That cortisol. Cortisol is almost a toxin, right? And it's very necessary for us when we're undergoing stress because it activates certain areas of our bodies, like raising our heart rate, tensing up our muscles. But unfortunately, it also restricts our diet, restricts our appetite. It might cause us to endure more stress by not allowing us to sleep, which is also vital for a baby. A mother's rest is very vital for the growth of the child. So it inhibits growth hormones, which we're also going to be revisiting later when we talk about stress and childhood development, okay? So not only is it in childhood development, but it's also in birth that cortisol is implicated in growth. So greater anxiety, really, if we can link cortisol to reduced growth hormone, what do you think is going to happen? What do you think the result is for a child that's being born?
Low birth rate.
Low birth rate, or low birth weight, right? So we'll see earlier births. We'll see less than that, 39 weeks for birth time, which also increases premature development and low birth weight as well. So anyway, anxiety and stress are linked to a lot of really bad things.
Wouldn't stress also like damage will cause harm to her, like the woman's immune system?
Yes.
Cause her more susceptible to illnesses?
Yes, absolutely. Thank you for bringing that up. I was just thinking, I thought there was one more thing. Yeah, so immune system is affected, usually decreased in the mother, which leaves her susceptible to viruses, which is another environmental concern, a risk factor for the mother. So immune system goes down, which that negatively impacts the unborn child. Okay.
And what about a mother taking medication for stress?
Okay, and we're going to get to that here in also a minute when we talk about teratogens. Okay. But what are some other, so let's talk about, I'll put that on my list. I have a different slide that I'm going to get to and talk about teratogens. What are teratogens according to your reading? Does anybody know?
They can be diseases, environmental factors,
Right.
basically, I guess, anything harmful to the fetus.
Environmental agents. Exactly. Environmental harmful agents. And I'll talk about those in just a minute. So I'm going to put a pin in that one for a second and let's consider some other risk factors. What are some other risk factors for a mother who's pregnant? I heard something.
Would nutrition be another risk factor?
Nutrition is a big risk factor. Why?
The mother has to take proper nutrients so the baby can grow properly.
Right. So the unborn baby has all these, remember what we said, that those cells are multiplying at an exponential rate. So we know that in order to enhance growth, we need to have the nutrients to do that. We need to have the proteins. We need to have the sugars. the sodium, all those things, the iron, all those things are necessary for building blood and building tissue. So if the mother's not ingesting the proper nutrients, then the child's not getting the nutrients. So the sharing does not occur with nutrients, and therefore the building of their bodies doesn't happen. One more risk factor that your book, I believe your book had mentioned.
Was it age as well?
Yes, mother's age, right? Why does mother's age have to do with it? Do with risk factors? What do you think? Okay.
The ability to carry a baby to full term depends on the age of the mother.
Right. So there is a kind of a sweet spot within age that a mother is ideal to carry. So girls or females usually hit puberty around what age?
Like 11, 12.
Okay. Yeah, 11 to 12, 11, 12 years old, okay, is where they start developing more defined sexuality characteristics and reproductive abilities. So that is like the low end of when a woman, a girl, would be able to start carrying a child. However, at the far end, what do we call it when a mother can no longer carry a child? What period do we call that?
Menopause?
Menopause, right? Menopausal, oh, sorry, kind of put that in. And that usually occurs, does anybody know the age of that?
Like 50.
Okay, right around, 50s, usually around mid 50s, early 50s to mid 50s. Okay, so I'll put 55-ish around here. Okay, and there's really no defined. Some women go a lot longer. Some women may experience menopause at an early, like maybe in their 40s. Okay, so it really varies. So within here, we don't want, because at this point, females' reproductive organs aren't fully developed. Okay, we usually don't see fully developed sexual organs until probably around 15, 16, and then about 17 is between 17 and about 42 is where we see probably the highest successful birth rates. Okay, another area, and of course, the further you get to either end of these, the higher the risk is going to be, okay? And that could be for many reasons. On this end, it's more biological, okay? This end, there is some biological factors to it, but what else? What else could be affecting risk factors at a young age? Think of yourselves, and many of you are probably closer to this age, but what were you like back when you were 16 and 17? Were you thinking about nutrition?
No.
Were you thinking about exercise? Maybe some of you.
Yeah, I was in sports.
Okay, all right. So, I mean, I was probably active back around then too, but I was eating McDonald's just about every day. Sorry if that grosses anybody out, but hey, I worked there and I got my meals there. Those kind of dietary behaviors are not great. How about caring, like making sure that you're not around people that smoke or drink or anything that could induce harm into the body. Probably not thinking about it at that age, right? Probably not thinking about the birthing process. So I see, Felicia, you put it in here, immaturity and economic factors. Absolutely. Are they going to have access to good health care? Are they going to be thinking about going to doctors regularly? So all these really affect. So education really affects this lower end of the spectrum. And it's very important for those of you that are going into any kind of counseling or nursing, it's very important to consider that, okay? Because education is an issue. Um, and okay, somebody put having a well-paid job to support the child. Yes, absolutely. Healthcare, right? How many children, how many teenagers have full-time jobs in healthcare to have children? Hopefully, maybe their parents do, but yeah, that would certainly be a risk factor. All right, so we brought up, and I forget who talked about what teratogens were. I think actually they said, whoever it was, they said drugs. So teratogens are environmental agents, right? That cause harm to usually to the fetus, but if not the mother. So we talked. One of them was drugs. What about drugs? Why are drugs important to understand?
Uh, your baby could could come out addicted to the drug if you do that. If you do it like cocaine or something
Okay.
throughout your whole pregnancy, they could come out addicted to it.
Okay. So addiction, not only addiction, but what else? What do you get as a result of addiction?
I can't sleep.
Disabilities.
Withdrawal.
Oh, yeah, that's true.
That withdrawal, right? A withdrawal is very, very hard on our bodies as adults. Imagine a baby who's born into the world and is going through those same withdrawals. That could be lethal. That could be very, very lethal and dangerous. So when we think of drugs, we can think of either prescription or illicit drugs.
So what happens if it's like an SSRI, not like a drug like that? Like what happens if the mother is on something that she needs to balance out herself? Like would she then have to stop that for the child? Or would that affect the child?
That's a really, really good question, because we already talked about stress being a risk factor, right? So how do we balance that? And this is and there's really no 100% correct answer in this, because it really is a juggling act for caregivers and medical staff to be able to balance, well, what level of stress can we accept versus given somebody that's mentally ill, like if a mother suffers from schizophrenia or bipolar or like severe bipolar or borderline personality or something, right? Or high stress, high anxiety, or depression even. Like certain levels of depression could cause suicidal thoughts and actions. So how do we do that? How do we get medicine to them without harming them? And it really is a delicate balance. So we'll look at SSRIs, which for the most part aren't really harmful that we know of. And of course, research changes every day. We do know that some of them are more harmful than others, like lithium, like Adderall, like I'm trying to think of codeine, morphine. Morphine is terrible because the child can go through withdrawals, right? So it's really a juggling act, and there's no good answer for that. But we have to consider what we do know to be harmful. I think I left you all a video either this week or last week on thalidomide, children of thalidomide. Did anybody view that? I thought I had it as a video. So thalidomide, back in the early 60s, 70s, late 60s, going into 70s, thalidomide was exactly that. So people that endured stress and anxiety and weren't able to sleep were prescribed a drug that was not well marketed, was not well vetted. It went through the FDA, but not through the greatest process of the FDA, and was not clinically tested well. And what they found in a very short time, that they administered this drug to mothers that were pregnant, and even after, because even if they had it while they were not pregnant, it still showed severe birth defects. And I'm talking children born without limbs, some of them maybe two heads or an arm growing out of their head. I mean, it was just deplorable. And if you have a strong stomach and you want to research that, just look up articles on thalidomide and how that affected so many children worldwide. I mean, it was just a terrible, not pandemic, but we had to pull it from its shelf and not administer it to anybody. I think they did find that it is probably the most efficacious medication for leprosy, which is, but the stipulation for people with leprosy that are taking it is you can't get pregnant because it will affect almost to like a 99.9% chance of affecting the unborn fetus. So yeah, drugs, even prescription or illicit, can have negative effects, right? See, we're kind of running up on time here. I was hoping to get through a little bit more here, but what are some other environmental agents other than drugs that can affect a child? I think somebody had mentioned it earlier.
Drinking?
Oh, well, that would fall under drugs and substances. Okay.
Would diseases?
What's that?
Would diseases be one?
Yes, absolutely. Diseases and viruses, right? So again, we have to balance, what kind of medication we're going to keep somebody. So if somebody's HIV positive or something, what kind of medication are we going to give them so that they can remain non-symptomatic or not have anything flare up? Herpes would be a pretty big issue, right? Especially if the mother is active during the birthing process. That child is going to not only have it in its blood, but might come out and contract it through the birthing canal. Some other chlamydia and syphilis, tuberculosis, all of those could be risk factors for early childhood death. Okay, let's see. I think what else? Environmental hazards. What about environmental hazards? What do I mean by environmental hazards?
Like more
Maybe like air pollutants that we might breathe in.
Yeah. Pollutants. Where do you live? Are you in like LA? LA is notorious for having pollutants all over, right? So that would be something you want to consider. But we have more than 75,000 chemicals that are common in the United States that can cause birth defects, low birth weight, or other birth complications, right?
It's not to cut you off. It said that some of the chemicals that be in like nail salons and stuff like that could hinder like childbirth and stuff like that, right?
Yep. Acetate. Yeah, acetane. That would be inhaling that. Maybe they work in an environment like a mechanic or something where they're breathing in fuel fumes a lot. Okay, so those might be something you want to consider, especially if you're counseling somebody who is considering having children or pregnant, and letting them know what is out there, because this is all about education, getting the education out to the people that need it the most, especially in lower socioeconomic status where they don't have access to these resources, right? All right. So let's see here. I'm trying to think what else I want to. I'm going to talk a little bit more about. Let's see. I think I'm actually going to call it there, because now we're going to get into newborn and kind of wrap that in with developmental stages as we get into this on Thursday. Okay, so any questions or anybody have any comments on prenatal before we get into neonatal? Did I lose anybody? Are we still good? No. Thumbs up, thumbs down? Okay.
Maybe.
All right. Any questions on anything as far as the class goes so far before we part ways today? Everybody understand the assignment for this week?
You just want us to pick one of the 3 stages, right? And then kind of discuss that a little further, like what goes on in that stage.
Yeah, let me bring up, I got to refresh my memory as far as what we had. I just got out of my to show you the database I got out of D2L. All right. So prenatal. Yep. So choose one of the 3 prenatal periods. So that's going to be the embryonic, the germinal, or the fetal. Okay. So one of those 3 stages. Description of what happens, include time frame of gestation, what occurs. Yeah, just a little write-up. Is it similar? Yeah, you can even regurgitate some of the things we talked about here today. And what would happen if a woman put in one of those teratogens into her system, like drinking or nicotine or something? Okay. Does that make sense?
Yeah. Does that one have to be an APA format too?
It does. Yep.
Okay.
So double space, 12 point Times New Roman, reference page at the end. So even if you have just one reference using your book, just make sure that you're citing your source, right?
Is this due on Friday?
I believe this is due on Saturday, right? September 20th. Is that Saturday?
Sunday.
Sunday. Okay. You got a bonus day this week. So Sunday. I think it says Saturday in your syllabus, but if you get it in Sunday, that'll be fine. Okay. Anything else?
Do you want the date on when we do APA format? I wasn't sure if you wanted the date.
So as I told all my other classes, if you want to put a title page in there, I'm not going to require a title page. I'm not going to mark down for a title page. It's a good practice to get into to do your title page, which is where your date would go. But again, I mean, I can identify that you turned it in, so I'm not going to be super picky on the title page. You will need a title page for your group project though, so don't misinterpret that at the very end. Okay.
Okay, I wasn't sure, so I didn't put a date on that last paper.
Yeah, you're fine if you didn't put a date on it.
Okay.
Okay, I got a question in chats. Sorry, did somebody ask something?
We don't need abstracts as well.
You do not need an abstract for weekly assignments. Okay, the other question I got in here was if I do the quiz right now, well, I still get points for it. Megan, stick behind and talk to me about that, okay? All right, anything else? All right, so go ahead.
I didn't have a question.
Okay. All right, well, thank you for your attention. I'm going to stick around for a few minutes here if anybody needs to talk to me one-on-one. If you don't need to talk to me one-on-one, go ahead and log off, but have a great rest of your day, and I will see everybody here on Thursday, all right?
You too.
Thank you.
Yep. Bye-bye.
I just had a quick question.
Okay, is it a private one or are you
Not
okay?
really. I logged on a few minutes late, so I missed the first 10 minutes.
Oh no.